I'm your good friend, Dr. Mark Ibsen, and I'm here talking to you representing the American Pain and Disability Foundation. We are a group of advocates advocating for pain refugees, pediatric patients who are unable to get their pain medicines, and veterans. We are seeking your donations and your support. I'd like to start off by reading my poem that came to me, and it's called Wheelhouse. I stand in the wheelhouse of our humanity, reporting and responding to reports of calm seas while navigating a Class 4 storm. And I know that my shipmates and I are on our own, and that we will weather this storm, return to port, and have something to say to the shore-bound navigators who kept lying to us about what was right before our eyes. I became an accidental pain physician in 2012 when pain refugees started coming to my office complaining that their doctor had dropped them from their pain medication. I was new in my urgent care at that time, following a 35-year ER career. And during my ER career, I would promise my patients that we have more medicine than you have pain. I can no longer make that promise. The relief of pain in America has become essentially a wasteland. We are trying our best to get patients who've been legacy patients, which means they've had pain medications for 30, 20, 40 years. These patients are now finding themselves cut off by a superstitious narrative. It basically says, Johnny was a high school quarterback, he breaks his collarbone, he gets some Percocet, and 7 years later he dies from a heroin overdose. Everybody assumes it must have been the Percocet. There's a lot of other variables involved in treating acute and chronic pain. And now even acute pain is untreated. Those of you who've had surgery in the last year can attest to the fact that they'll do a knee replacement and then give you Tylenol when you're discharged. We don't think that that's the right way to manage it. In fact, we think it's the wrong way. And I did a video about the wrong way. You can see that on Facebook. What we want and what we're asking for is to designate pain as a separate disease. Pain and pain patients have a separate illness. Addiction is not the same as dependence. When you're addicted to something and you use that substance, your life spirals out of control. When you're dependent on something and you use that medicine, your life returns to control. More structure, more fun, more power, freedom, self-expression, and ability to go to work and pay your taxes. So we want our legacy patients to get what they need. Yes, there's a lot of people talking about addiction these days. 3% of our population has addiction problems, but we have 30% of our population, over 100 million people in pain in America, and these people are being ignored. We need your help. Please see the numbers, and please donate to the APDF and help us to help you get your pain taken care of. Thank you. Enjoy the rest of your day.